In this morning's Health Watch, arthritis and exercise. 1 in every 5 adults has arthritis symptoms that can make it painful just to move, let alone working out. Yet doctors, including medical correspondent Dr. Jennifer Ashton, say the right kind of exercise is actually the best thing for your aching joints. This is kind of a tough pill for a lot of folks to swallow. What is it? I think 40% of arthritis sufferers say it's just too painful to do any physical activity. So how could exercise actually help?
Well, it's a little counterintuitive because, as you say, the last thing you want to do is do something that causes pain. But first, we have to put this into context, Erica. You know, we used to think of arthritis as a condition that only affects the elderly. Not so anymore. We're seeing this in younger people, partially because of obesity, partially because of overuse injuries. So it's not uncommon today to see someone even in their 30s suffering from arthritis. There are lots of different types. Basically, though, you're talking about an inflammation in the joint that causes the cartilage to break down, and eventually you're dealing with a bone-on-bone situation. So what exercise can do, it can not only release those feel-good chemicals known as endorphins, but it can improve blood flow to the area, it can increase your range of motion, and really all of those things put together are going to make you feel better, not worse.
Okay, so then what's some of the best exercise you can do for these stiff joints?
Well, really, when you talk about the best things for arthritis sufferers, you're talking about low-impact activities. So things like swimming is great because that's putting no pressure on your joints. Hiking, biking, even dancing, those are all things that cause your body to move in 3 dimensions, and so it's great overall exercise and doesn't put a lot of undue stress on those joints, which are already inflamed.
I would imagine that would mean certain things you should avoid, like running.
Exactly. So on the flip side of the spectrum, the things that are really bad for people suffering from arthritis, or in general bad for our joints, those very high impact exercises or activities, running on hard pavement is a big one. Even things that are very trendy and in vogue right now, like kettlebells, might be good for the very young person with no joint problems, but if you have a tender or inflamed joint that's at risk, you want to stay away from those things.
So for people to start to see some improvement by adding in these exercises, I mean, how do you work that in? Is there a certain number or target that you should have every week in terms of days or amount of exercise?
Well, the key thing is you want to do it gradually. You don't want to go from a period of being immobile to doing high level of activity. And if you look at what the CDC recommends, for example, for people suffering from arthritis, they really tend to be a weekly plan. You want to strive for about 150 minutes a week of aerobic or cardiovascular activity. You want to include muscle building or strength exercises about 2 days a week, and balance and flexibility key. You want to do that about 3 days a week. And again, you want to start slowly, build up gradually. And these are exercises that are good for everyone, not just people suffering from arthritis.
Great stuff as always, Jen. Thanks.
You bet.